Hey everybody, Dr. G here. I'm a licensed clinical psychologist and personality disorder expert, and today we're going to be talking about negativistic personality disorder. So what is negativistic personality disorder? It's not a disorder that's in the DSM, which is the manual that I use to give people diagnoses, but it's one that I've seen people talk about, and it describes a cluster of behaviors. Essentially, it's when people are chronically passive aggressive. So what I'm going to refer to here on, I'm going to refer to it as negativism or being passive aggressive, since it's not actually a personality disorder, but I do understand why people call it that. In essence, people that are negativistic are exceedingly pessimistic. They have negative attitudes, they've got a negative energy, and their purpose is to make everybody else feel negative around them. So they'll create challenges for no reason other than just to create challenges. They will be stubborn and difficult for no reason other than just to be stubborn and difficult. These people are negative and they will make everybody else around them feel negative if they get what they're trying to do. Is negativistic personality disorder the same thing as passive aggressive personality disorder? Yes, it's the same thing. Different labels for the same two clusters of behaviors. And as you may know, being passive aggressive is a way to try to engage in hostile or aggressive behavior while acting as though you're not, so that you'll have some deniability and say, well, I wasn't doing that, even though you're clearly being aggressive and passive at the same time. So what are the kinds of signs and symptoms you see in people that have a negativistic personality? Well, they may sulk. They obviously are going to get passive aggressive, as we're just talking about. They're going to be stubborn. They're going to be difficult to get along with. They are chronically going to feel like they've been dealt a bad hand in life, and everything they say is going to be colored by this. So one thing to understand is that even though people say negativistic personality disorder, it's very possible someone has a diagnosable DSM personality disorder, like histrionic personality, narcissistic personality, antisocial personality, borderline personality. There are a whole lot of personality disorders, and I've done lots of videos on these, so I highly recommend, if you're interested in those, check out my channel, look at the other videos I've got, because it can help you better understand all of those. And also, while you're at it, you might as well like and subscribe. And so, I think most of us have known people in our lives that made us feel very frustrated because they were so endlessly negative. And the thing to understand about people that actually have personality disorders, if there's a personality underlying this negative or passive-aggressive behavior, is that people with personality disorders struggle and essentially can't, without a really good intervention, become adaptable or flexible. These are people that at their core have no ability to be flexible. So if your view on the world is exceedingly negative and your goal is for everyone else to feel negative, no matter what interventions people bring to you, no matter what solutions people have for you, you're going to maintain that perspective. I think all of us have known people like that. And if it's someone who's narcissistic because they're grandiose and they think everybody needs to do what they say, then that falls under the purview of actually being a narcissist who engages in negativistic behavior. If it's someone who has borderline personality and feels like they're being victimized by the world, that also is going to display itself in this negativistic or passive-aggressive way. What are the treatment options for something like this? And that's a really good question, because you have to first identify what the underlying issue is. You're not going to walk into a doctor's office and they're going to go, you've got negativistic personality disorder, let's treat it. Really, if you're engaging in a pervasive pattern of negativistic behavior, obviously that's dysfunctional. So whether it's depression, anxiety, personality issues, you've got to have somebody who's very skilled in this area that can evaluate you and tell you exactly what's going on. And it might take a while, because just one session might not be enough to help you, or maybe your loved one, better understand what's going on with them. And if it's somebody who's got a very negativistic view, they're probably going to go, this is a waste of my time, therapy's a waste of my time, so on and so forth. Treating people like this is very challenging, and I can tell you as a personality disorder expert, it's one of the most challenging presentations that somebody can come in with, if they're just exceedingly negative about everything. And sometimes these are people you can't get through to. This is a very challenging cluster of issues to have. In terms of how a person is diagnosed, it can be through different kinds of psychological measurements and assessments that you can get. Most likely it's going to be through therapy, through what we call a clinical interview, where you're asked questions. It's going to be basically if a skilled therapist is able to understand what the person is going through and make some connections, see their level of insight, because people with true personality disorders do not have insight. They're not able to look inward and really understand what's going on. But in order to get help for this, it does need to be an accurate diagnosis. Because if you have somebody who has this negativistic perspective, who does have a personality disorder, and they're trying to treat an anxiety disorder or just a plain old mood disorder like major depressive disorder, and that's the way they're doing it, it's not going to work. So they're going to get frustrated. The therapist might get frustrated, and it's not going to help anybody move forward. So it's super, super important that if this is something that you're helping somebody get treated for, if it's something you're getting treated for yourself, that you give the therapist as much information as possible. That's always the most important thing, is accurate information and lots of it. So how do you live with someone with a passive-aggressive personality? Because the vast majority of us get exceedingly frustrated when somebody engages in passive-aggressive behavior. I mean, that's the point of it, is to annoy. It gets in the way of so many healthy behaviors. And so living with someone like that, first of all, if it's a situation where you're with somebody, or it's a family member, or it's a relationship that really you're just going to have to live with, it's going to be a matter of understanding what you're seeing and not letting it impact you. And I know that's way easier said than done. I know that it's easy for me to sit here and say, oh, just be able to ignore it. And it's not so much ignoring it, it's a matter of understanding it. It's understanding if someone has a negative perspective of the world, they can't see it otherwise, and they've got an underlying personality issue where they can't adapt, they can't become flexible, they don't have insight, then you have to be expecting this kind of behavior. You can't think, well, if I do this today, they're going to behave differently and everything's going to be okay, because they'll probably disappoint you and you're going to walk away frustrated. So the goal is going to have a very realistic perspective on this person's behavior. And that is going to help you live with somebody like that. It doesn't mean there are not still challenges. It doesn't mean that there's not still great challenges. It just means that maybe you can tolerate it a little bit better. So what are the differences between just passive-aggressive behavior and a personality disorder? So people with personality disorders can oftentimes be very passive-aggressive, but other people can be passive-aggressive as well. So just because somebody's engaging in passive-aggressive behavior does not necessarily mean they have a personality disorder. The way to really distinguish the two is a matter of degree, it's a matter of amount. If someone is chronically passive-aggressive, if they can't change their behavior, if they're not changing it, and they're just being relentless about it and it's ruining their lives and everybody around them, that's more along the lines of what we'd see with a personality disorder. If someone is just being passive-aggressive because they learned bad ways to cope, or they're being frustrating, or they just don't know how to better interact but are capable of change, that's more of just passive-aggressive behavior. I wouldn't diagnose based on what I'm saying. You really need somebody who's skilled in this area and who understands it really well to be able to actually diagnose the difference between passive-aggressive behavior and a personality disorder. But in general, it's a matter of degree. It's a matter of how chronic it is. So in conclusion, negativistic personality issues are incredibly, incredibly difficult to deal with. If you're with somebody that has these issues, I actually have a quiz that you can take below that can help you better understand the impact that a conflicted or negative relationship is potentially having on you. But it doesn't change the fact that being around somebody negative all the time will impact you. It's almost impossible for it not to, no matter how cheery or positive your outlook on life is. If you have somebody who's constantly reminding you of all the things that they don't like, of all the things that you shouldn't feel good about, and so on and so forth, it's very hard to center yourself, to feel good. It's going to be a matter of figuring out if the person who's engaging in this behavior is capable of changing and if they're willing to do so. Anyway, if you enjoyed this content, please like and subscribe. Thanks for watching.